So thank you all so very much for being here with us this morning. It's not often that we have a chance to talk about something that's unprecedented, and we are here to do just that, and I'm really, really excited about it. I have been in the industry for almost 3 decades, and I can honestly say that this is, for me, the most exciting and interesting activity I have been in that whole period of time. It is truly historical. This hotel is actually the place that all of us standing up here have spent almost hundreds of hours in to get to the point that we are here today. We receive a lot of feedback from our members about what they're looking for in the healthcare system. They want quality, they want choice, they want affordability, and they want simplicity. So we got together with the top 7 hospital systems in the Los Angeles and Orange County: Cedars-Sinai, Good Samaritan Hospital, Huntington Memorial Hospital, MemorialCare Health System, PIH Health, Torrance Memorial Medical Center, and UCLA Health. Now, after a year together, locked up in these conference rooms, we are ready to announce the fruits of our labor: Vivity, an integrated health system in LA and Orange counties. Vivity is a very unique collaboration. This is the first time in the country that an insurer and 7 competing top quality hospitals have completely aligned around maximizing health. In this new joint venture, Anthem and these 7 hospitals have formed a limited liability corporation and a shared P&L. The business model of old for hospitals has been to keep their beds full. Under the new model, the 8 of us are successful only when we keep people healthy and out of hospital beds. The partnership will reduce inefficiencies in the healthcare system. The Institute of Medicine estimates that 30% of health spending is unnecessary. Working together, we'll find ways to become more efficient. An example, an opportunity is directional clinical data sharing. So if you happen to be, as an example, if you were unlucky enough to be doing some home repair work and you stepped on a nail, if you went to your doctor, the first question your doctor would ask you is, have you had your tetanus shot? And if you are like me, you would say, I have, but I don't quite remember when. And so they would give you a tetanus shot. Can you imagine the power of having these systems all working together, sharing data, and able to tap in and avoid that unnecessary tetanus shot? There's administrative redundancies that we'll be able to address as well. For instance, in the future, right now most of us all here have 24/7 nurse support programs. Do we need to have 8? Probably not. So is there a way that we can pool our resources and really address the administrative redundancy in the system? You can see the opportunities are pretty exciting and pretty significant. There is so much I want to tell you about this program, and we will have a chance to do that, but I do want to have a chance for us to talk to our partners, and let me introduce who we've got here with us today that have been just instrumental in making this happen. Starting to my right is Jim West. He's the president and CEO of PIH Health. He has hospitals in Whittier and Downey. To the left of Jim is Craig Leach, president and CEO of Torrance Memorial Medical Center. Then we have Steve Ralph, president and CEO of Huntington Memorial Hospital in the San Gabriel Valley. And to my left is Barry Arbuckle. He's the president and CEO of MemorialCare Health System, serving Los Angeles and Orange counties. And he has 6 hospitals, and let me just rattle those off: Long Beach Memorial, Miller Children's and Women's Hospital Long Beach, Community Hospital Long Beach, Orange Coast Memorial, and Saddleback Memorial Laguna Hills and San Clemente. Andrew Lika, to the left of Barry, is president and CEO of Good Samaritan Hospital in LA. And then Thomas Prisalak, who's the president and CEO of Cedars-Sinai Health System. And then lastly, to the far left, is Dr. David Feinberg, who's president of UCLA Health System and CEO of UCLA Hospital System. So I just want to thank all of you. It's been just a really gratifying experience to work together to really change the medical delivery system and evolve it to this next level. We all have great things to say about what's happening here, and all 8 of us are very, very excited about it. But if we all talked, we would be here till next Tuesday. So I'm just going to ask a couple of our partners here to come up here and make a few comments, and I will ask Barry to start. Barry Arbuckle from MemorialCare to come up and tell us a little bit about his thoughts about this venture.
Well, thank you, Pam, and thank all of you for coming today. As she said, my name is Barry Arbuckle. I'm the president and CEO of MemorialCare Health System. In addition to the hospitals that Pam listed, we have 2 leading medical groups, MemorialCare Medical Foundation and Greater Newport Physicians, and now scores of ambulatory centers throughout South LA and Orange counties. When this group first came together to start discussing the creation of Anthem Blue Cross Vivity, we wanted to do something that we could create that was greater than the sum of the individual parts. And now that we're completed with creating this new product, this new relationship, this partnership, I think we'd all agree that we have exceeded that goal. While we each individually provide quality care to our communities, to our unique communities over many, many years, coming together allows us to leverage the strengths of each organization into something that is better. Our partnership is the continuation of one of the trends we're seeing in healthcare, and that is tighter integration among insurers and the delivery system to drive better health outcomes. The accountable care organizations that you've seen created over the last several years are one example of this. Vivity takes that several steps further. By developing a joint venture where both providers and the insurer are aligned to create long-term sustainable product, we can provide affordable care and access to the best care our communities have to offer that employers and the communities are seeking. Using new technologies and shared goals, you will see the region's leading hospitals and medical groups working together to make care more convenient and affordable, whether it's primary care or acute care. Vivity is another significant advancement in the evolution of accountable care. I look forward to working with my colleagues who I've known for many, many years on this exciting project, and would like now to hand the podium over to my friend Tom Prislak from Cedars-Sinai Health.
Thanks, Barry, and good morning, everyone. I'm Tom Prislak, the president and CEO at Cedars-Sinai here in Los Angeles, and it's good to be with you all this morning. You know, over the years, Cedars-Sinai has worked closely with Anthem in a number of different ways. Some recent examples include being a part of their accountable care organization for treating patients suffering from multiple chronic care conditions. That's been a part of our relationship recently. And more recently, we will be part of the Anthem offerings on the Covered California, the exchange here in California, and we're excited about that. But we're here today really to celebrate the creation of Vivity, and we're very excited about the opportunity to be a part of this latest effort on Anthem's part to address the issue of affordable, high-quality care. You know, my remarks, I guess, would probably be more from a patient point of view and thinking about what it is that's in this for the patients. As Barry alluded to, first, it's access to an incredibly great network of primary care physicians, some of the best in the state and some of the best in the country. And when necessary, those primary care physicians are going to be backed up by some of the best specialists in the country as well, assuring patients that should they need the most advanced care, they'll be able to get it within this particular network. The economics of healthcare for patients are oftentimes confusing, and I think there's an effort here to simplify that with this particular product, an effort specifically so that the patient knows that their out-of-pocket expenses in advance is limited to their copay that they may have for a particular service. And then finally, navigating the healthcare system is not easy for all of us. Frankly, it can be a challenge even for those of us who are within the system. And Anthem will be providing navigators and concierge service as part of this to help patients as they find their way through the healthcare system. So a lot of this, I think, has many elements that will benefit patients throughout Southern California. So we're excited at Cedars-Sinai to be a part of this, and we look forward to the creation of something new and something that will advance the ability of healthcare providers to provide high quality and affordable care. At this point, I'd like to turn it over to my friend and colleague, Dr. David Feinberg. David?
Thank you, Tom. Good morning. Thank you, Tom, and Pam, and everybody else. This is an exciting day for us, particularly at UCLA. My name is Dr. David Feinberg. I'm the president and CEO of our UCLA Health System. And at UCLA, our purpose is to heal humankind one patient at a time. We do that by alleviating suffering, promoting health, and delivering acts of kindness. And we know for sure that we can't do that alone. So if we're really going to go after humankind, we can at least start in Los Angeles and Orange County. And the organizations that I think are represented here today represent not only great diversity from a geographic standpoint, but represent great diversity from the neighborhoods where our doctors and our hospitals exist. And so it's really a proud moment for UCLA to be part of a team where we've been talked about sometimes as competitors, but I believe that really the competition here is heart disease and cancer and diabetes, and making sure that all of us engage together to combat those things. As many of you know, CalPERS is the largest purchaser of benefits in the state, and I believe the second largest purchaser in the nation, just behind the federal government. They're often on the cutting edge of finding better ways to serve their members, and have partnered with us and Anthem and other providers here in the past. And I'm really happy to announce that CalPERS will be the first to sign up for the Vivity Network. Doctors and hospitals will be available to CalPERS members through their select HMO product, both in Los Angeles and Orange County. So we're excited to be part of this, and I think the participation of CalPERS really speaks to affordability, quality, and access. UCLA is very, very proud to be part of this as an academic medical center. One of our missions is to train the leading healthcare providers of the future. And to do that, we can't train them in the old model. They have to be able to see what it looks like when care is coordinated, when care is of the highest quality and safe, and when the right care is delivered at the right time by the right people. So Vivity for us is not only a great opportunity to provide great clinical care in the greater part of Los Angeles, but to make sure that the doctors that are part of the David Geffen School of Medicine and our residents are exposed to what we think is the most leading edge now healthcare delivery system in the country. So allow me to please turn it back to Pam and make it really clear none of this would have happened without Pam.
Thank you. Oh, that's so sweet. Thank you. Thank you all. I do want to say that this has been probably the genesis of this started, I would say, 3 years ago. And it started with conversations with all of these people that are standing here. And we, everybody up here cares very deeply about the community and delivering high quality, effective, efficient, affordable care to the people in this community. And this is really what we're rallying around. And it's an honor to be up here with these people that really are here to do the right thing for the people that live in our communities. I want to just fill in a couple of technical details, and we'll at this point, when I'm done here, we'll turn it over for questions. But the Vivity will only be available initially to companies with over 50 employees. That's and they will be accepting proposals starting October 1st for a January 1st, 2015 effective date. This is something that we want to keep growth fairly controlled until we figure this out. And then at the point that we've got all the basics down and we're doing this right, this group will talk about how or if to expand the population and potentially even the geography. But we don't want to mess this up by overwhelming it with volume. So we are just limiting it to the large group employer market initially. We are really at a transformative time in the industry. I've seen more changes occur in the last couple years than I have in the last 30 years. This is a very exciting time to be in health insurance and in the medical delivery system. Vivity continues to move away from traditional fee-for-service, where there was an incentive to actually increase the number of services that individuals received, and evolving this to a structure that financially rewards activities to provide top quality care to keep patients healthy at an affordable cost. All of us work together, long hours, in a way that we hope we're going to produce something that will be simple and affordable for the people in Los Angeles and Orange counties. I think that we are launching something remarkable and excited to be here to talk about it. So thank you for listening. I do want to open it up for questions. I'm going to ask the operator to provide instructions for callers who want to get into the question queue. And once we do that, we'll start here in the room and then move to the callers. I think the operator's talking now.
Star one to ask an audio question.
Okay. All right. I will not be just me answering these questions. We'll be opening up if you want to direct your questions to anybody up here. Please do so. Take questions here in the room. Yes.
Can you explain how this would be different for patients? It's not fee for service, so they only have to pay a copay.
Yeah.
Can you expand on that?
Yeah, and I'll start unless anybody else wants to take that. Okay. If you're an average consumer looking at a piece of paper that outlines your benefits, you're not going to see a big difference. It's a copay plan. We have designed it so it's very simple. We don't have deductibles where people have to get confused about what share they owe, what share the insurance company is going to pay. So we've made it simple from a benefit perspective. What is different about this is the actual experience once they're past the enrollment. The experience will be coordinated. We will wrap programs around this to create a patient-centered experience. We're all invested in coordinating to make sure that end-to-end care is managed and that we work to keep people out of the hospital through wellness programs, through communications. So the difference that an individual would see would be a much more consumer-centric approach to managing health than they would in a standard benefit plan design. Does anybody want to add to that?
You did beautifully.
Thank you. Thank you. Okay, we have a question on the phone.
We do. Your first question comes from the line of Joseph Kahn.
Yes, this is Joe Kahn with Modern Healthcare, and I cover health IT for the magazine, so my question is going to be centered on how do you plan to get these 7 hospital systems to share data with one another? I understand some of them are Epic, some of them are Cerner. And are you going to create a central data repository, or are you going to be able to, how are you going to go about physically doing that?
Yeah, it's a great question, and certainly something that the founders, we call ourselves founders, have talked about, because certainly the one of the advantages or one of the distinctive differentiators here is going to be the ability to share data so that we all can see the end-to-end view of the patient. So we will be sharing data with the hospitals around that Anthem has. So we will be sharing the clinical records that we have that's based on lab results and claims that are submitted. So the hospital partners do have access to the end care. That will be something we can provide right up front. But what we have talked about from a longer term perspective is how to make that more interactive. How do we evolve that? How do we use some of the evolving technologies to connect together so that we are communicating real time? That's a future vision that we would love to move toward, but right now we will be able to start out of the gate by sharing data about that we have, that Anthem has with our provider partners. Yes.
For the consumers who are looking at this as an option for a plan, you talked about, when you look at it,
on a piece of paper, as most people do when they're trying to make a decision. You're talking about no deductibles, so only a copay, premium and copay, no deductibles, no percentage of whatever your procedure was or your surgery. Is that correct?
Yes, that's correct. Yes.
Can you talk a little bit about, there were some comparisons made today in the LA Times about Kaiser. Can you talk about how about that at all? Is that a system that you're looking at as a model? Is it totally different? How would you characterize that?
I'm so glad you asked that question, because it is starting to evolve into a Kaiser story, and we all of us have the utmost respect for Kaiser. Kaiser is an integrated delivery system that does a tremendous job. And this was not designed to go after Kaiser specifically. What we're recognizing is that the most effective delivery model is an integrated delivery model. And so the genesis of this initiative, this venture, came from that recognition that we can reduce waste, we can improve quality of care, we can provide people access to the top facilities in the nation, frankly. These hospitals represent the top facilities in the nation, and do that in an integrated way, and that's the value. So, we recognize that, Kaiser, Geisinger, those integrated systems, there's value there. And so it's really about the value that an integrated system brings and our recognition of that versus, targeting Kaiser, which kind of is where this seems to be heading. Anybody want to add to that? Okay, just tap me on the shoulder. Any questions on the phone?
You do. Your next question comes from the line of Ron Scheikman.
Hi, Pam. I'm checking from Cedars-Sinai. Outline some of the things you have regarding managing these issues, coordinating care of patients, and cutting down on the hospital admissions and things like that.
You want to take that? We have a very bad connection. It sounded like you were underwater when you were saying that question. Could you try it maybe closer to the phone, or try something different to see if we can get that?
Okay. Can you hear me now?
That is better, I think.
Okay, I apologize. I'm turning to my computer for this call. I wanted to know if you can talk about any initiatives you have for dealing with chronic disease issues such as diabetes, hypertension, coordinating hospital admissions, and those kinds of issues. Well, the sort of issues that ACO-like organization.
So I think the question is, how does this program incorporate a focus on chronic conditions? Is that kind of the gist of the question?
Yeah.
Okay. Okay. Good. It's an interesting question, because the chronic conditions, if you look at kind of the distribution of claims cost, about 10% of people drive over 70% of claims costs. So you've got a population that has these chronic conditions that really are sick and they need focused care. An integrated health system is the best environment to take care of those people. And there's huge opportunities for us to do that. We will be providing reports that will identify those chronic members so that the right focus for under this Vivity partnership can be placed on those individuals. Just a story. It's incredible when you look at the complexity of care that is involved with individuals that have chronic diseases. It spans from the physician to the hospital to their care at home, and if all of those pieces don't work together in the best way, you have health quality issues and you have cost issues. And an example of that is I was talking recently to somebody that June Simmons that works at the Partners in Care Foundation, and she was talking about a care at home program. They actually went to somebody's home that had been in the hospital for a chronic condition, and they went in there to make sure that they had the tools and resources they needed to take care of themselves at home. What they found out was that this woman that they were checking on was supposed to be on prescription drugs, and she was supposed to take them with every meal. Well, she only ate one meal a day, and so she took all of the pills at lunch. And it's that kind of thing that ends up landing people back in the hospital. And so, working together and putting wrap programs around this chronic care management, we can address those really significant quality of care issues, and Vivity is designed just to do that.
In the economic model, we have to. Hi, this is Jim West from PIH Health. The basics of this whole construct for all of us is that we're integrated delivery systems, and the economic model that we're following drives us to we're not going to be successful economically as organizations or for the patients or the consumers if we're not managing chronic diseases and reducing our costs. We're not getting, we're sacrificing the fee-for-service payments that we're normally used to getting for basically a prepayment system similar to Kaiser, and so we really have an incentive to work together, share our resources, learn from each other, and then get data from Blue Cross and really take care of the patients we have. And we've talked about including the employers in our discussion because it's really important. They have a big role in helping us help their employees come together and reduce their utilization of services, which in turn keeps them healthy and at home. So that's really the basis of this. So thank you.
It's beautifully said. That was Jim West with PIH. Yes.
You started talking about this 3 years ago. Why? Why did you start talking about this?
And it was various conversations, one-off conversations with people up here. And I think I would attribute probably the catalyst for the conversations was healthcare reform and the ACA. And we all kind of came to the conclusion that the system as it stands today is not sustainable. And the government was stepping in to try to address problems, and I think there was a general recognition that we owned a part of that problem, and we had to step up and do something differently. And so those out of that, these conversations started. We have had conversations with the medical delivery system, and insurer and medical delivery system normally 10 years ago kind of really honestly fought about unit cost, and we said we can't do this anymore. The system can't support that. We have to talk about how we can work together in a much more collaborative way to improve the quality and the cost of the healthcare system. And so I would point it back to healthcare reform, but I don't know if anybody has
Hi, Steve Ralph, I'm CEO at Huntington. I think one of the beauties of this 7 and then with Anthem is we're all learning organizations, and yet we've all been around a long time as organizations, 100, 120 years. And I think we can also work together very closely, as Pam said, to think about a new approach. How do we provide care that's accessible, that's excellent, and that's cost effective? And I think learning amongst all of us and our medical staffs and physicians is going to be very, very important in this endeavor going forward. So we're very excited about it.
Thank you very much. Any more questions? One more question on the phone?
We do. The next question comes from a line of Bob Herman.
Hi, this is Bob Herman over at Modern Healthcare. Just a couple quick questions. First of all, how are providers actually getting paid under this arrangement? And also, is there certain regulatory review that needs to happen with this new company?
So in a very probably the easiest way to describe this is that Anthem will collect premiums from members that enroll in this program, and we'll use those premiums to fund the cost of care that's delivered through the Vivity partners. We'll use this premium to deliver the cost of administration, like picking up the phone and issuing ID cards. What's left over goes into a pool that's distributed amongst all of the founders. So the financing mechanism is at the end of the day, the profit that's left over gets put back into the LLC and is distributed to all of the folks that are standing up here. And then I forgot the other part of the question. Regulatory approval. We have obtained our LLC license, and we have filed the plans with the local regulators, so the plan designs have been approved. So we're legal. Okay, we have a question right here. I'm sorry, I cut you off earlier.
Questions right now, but will there be any new infrastructure here? Are people just going to be going to the different hospitals? Or you said wellness programs and things like that, so in communication, so will it be a lot of mailings?
Yeah, we're not going to have new buildings, so to speak, but what we're going to do is aggregate the various services and programs in a unique way for these members. So we'll pull in things like mobile health alerts and wellness programs, wellness resources, gym membership discounts, things that really strive to improve overall health. We'll aggregate those together under this product offering delivered by the folks behind me.
What kind of financial investment is it going to take to get this going? I mean, it must be a lot.
Well, the one thing to think about is that we all have the infrastructure already. What this really, and I will say that we all are contributing to the organization financially, but we all have the infrastructure existing. What we're doing here is putting it together, putting the puzzle together in a better way. And so we're taking all of these resources and we're aligning them differently to create a different and more improved care experience.
Cheaper than Kaiser, the same?
I hate to make the comparisons to Kaiser. It will be cheaper than the competitive market right now. So by aligning resources and getting waste out of the system through this integrated approach, the premiums will be lower than what exists on the market today.
Can one of the system presidents discuss sort of the thinking as you went through this process with Anthem? Why was this good for you? I'm assuming you ran formulations about, what's going to be more profitable for the hospital or better for your patients. Can you talk about that process?
Hi, Craig Leach, Torrance Memorial Health System. I think, like Pam said, this started a couple of years ago, and as we got into it and saw who else was going to be involved and saw that this was really going to be a new venture that did focus on quality improvement. I'm going to start with that because we all have made commitments to achieve certain quality levels that probably collectively we've never done before. So that was first. Second, we wanted to make sure that we were offering a product that we were all available to the consumers in LA and Orange County. And for Torrance Memorial, that was important to be amongst the leading hospitals in LA and Orange County. And we're all committed to efficiency improvement. So we saw the tenants as being something that we believed in. And then beyond that, we started looking at this product for our own employees. And we will be offering this product this fall to our own employees, believing that this is a product that is better than anything else that we've ever been able to offer our employees in this kind of an environment. So.
Will Blue Cross stop offering the other?
Do you want to talk about that, Pam? I don't think so, but maybe Pam can answer that better than I could.
Before I do that, is there anybody else that wants to comment on the question that was raised? Andy, why are you doing this? Why are you here?
I'm the shy president and CEO in the crowd here. My name is Andy Leaka. I'm president and CEO of Good Samaritan Hospital. I think as been mentioned here, this collaboration actually took place a long time ago in terms of discussion. What's exciting to me is if you look at the hospitals and the health systems represented here, I mean, Cedars, UCLA, PIH, and others, these are the best of the best hospitals out there. So I think there was a lot of careful thought given to this. And, competition is tough. Collaboration is really tough. So in this room, I have some of my competitors. So how can you really take the best of the best here and kind of do jujitsu on it and flip it around to where it's to your advantage? And what I really look forward to in terms of collaborating with my colleagues here, not competitors, is looking at best practices for quality. And we have them right in this room. There are hospitals represented here that are the 50 best in the nation. And so how can you get a geographic coverage that's really convenient for patients, where they have choice, the pricing is right on this, but more importantly, all of us are working together to collaborate for safer healthcare, for quality healthcare, for customer service that is just, at the top of the scale, not only for our region here, but really as a leader within the nation.
Can you, Andy, talk a little bit about, I'm going to play the cynic here, but, of course, quality care for patients and, better health outcomes. What about the bottom line? How did you, I'm assuming everyone looked at that.
Right. So I don't think you can approach today's environment using the same tools as you've used in the past, because there's usually a winner and a loser. So traditionally, with Anthem Blue Cross, when they came in and we're setting a contract, we're not aligned in terms of incentives. So I'm trying to extract more out. They're trying to extract, less of an increase. And yet healthcare expenditures kind of keep climbing up the way they have traditionally done. Right now, we are all aligned. We're aligned. We have a set budget that we're coming in with, and we have to price that very attractively within the marketplace so that people take a look at this and say it's affordable. And in fact, even more affordable than a plan that they might have. I also think it's important, my niece, she's 26 years old, she just had her first baby, and I asked her about her experience. She lives up in Oregon. And for that co-insurance that we kind of briefly went across, if you have a $10,000 bill, and even if it's a 20% co-insurance on it of $2,000, you look at the number of Americans in this nation that have $2,000 on hand to pay for that care, and believe me, I heard statistics yesterday that 40% don't have $2,000 on care, so what are they to do? So when you have a small deductible coming in and the rest is covered, I think the thought process goes towards healing, not towards, traditionally, how am I going to afford this? And in certain cases, bankruptcy. So, that's where the folks up here have really dedicated their lives and their career, is to be able to bring about a change that is affordable and is accessible for Americans.
Just want to expand on one thing that Craig said that I think is a really important component of this program, and that's that while we are all putting the profits in the middle to share, the ability to access any of our fair share of the profits will be contingent upon hitting certain quality guidelines. Those are to be defined, but this group felt very, very strongly that this is not all about cost. This is even more about making sure that we are delivering the best quality care possible. And so it was an important tenet to this group to make sure that was incorporated into the program. We have a question on the phone.
We do have a follow-up question from the line of Joseph Kahn.
Yes, thanks very much for taking one more question. Data is great. Data analytics makes the data useful. Who's going to be doing that with this organization? Is that going to be one of your shared services, or is that going to be relying on each individual one to do their own?
Hi, Joseph. So we, at Anthem, we do have an infrastructure that allows us to produce actionable data upon which you can really use to support treatment, medical treatment. So we will be pushing that data out to our partners. However, over time, we have talked about, is there a way to take that to the next level and move to bi-directional data sharing? In California, there is an initiative called Cal Index, and actually David Feinberg is the chairperson of that particular initiative. And that program is, the goal of that program is to collect data from all of the insurance companies and from all of the medical providers, aggregate it so you have an end-to-end patient record. So we are in the future hoping that that's an opportunity for us to tap into that to really utilize that data in a very positive way. But we will start with what we've got, Joseph, and what we can provide to the founders. We will build on that over time. Okay, I think, are we done? One more? We're done. We get that. Okay. Thank you all very, very much for coming. I hope you see the excitement that we all have for this. This is, again, from my perspective, historic. I think it really is evolving the medical delivery system in an extraordinary way. And I'm personally very honored to be a part of it with these amazing people that are standing up here next to me. So thank you all very much for coming.